welcome to India TV. I am Shivangi. Well, cancer is a complex group of diseases and it can affect any part of the body. Moreover, it can pose significant health challenges. So to talk more about that, we have with us Dr Anil Thakwani, Director and Head Department of Oncology at Sharda Hospital. Hello sir, welcome to India TV.
Thank you, Shivangi.
So sir, first of all, I would like to ask you, what is cancer and how it starts?
So, Shivangi, basically cancer is an uncontrolled multiplication of the cells. What happens to our body, like whenever there's a trauma in our body, so there's a check mechanism which takes care of that amount of cells are required. After that, the multiplication stops. But when sometimes what happens because of the genetic changes or environmental factors, that check mechanism is defective. So what happens, there's an uncontrolled multiplication of cells which leads to the formation of the lump. That lump can be benign or malignant. Like not all lumps are cancer, I mean. So sometimes it is benign and sometimes it is malignant, and we come to know about that after getting the battery of investigations done.
Right. So sir, what are the symptoms of cancer that people must be aware of?
Yeah. So it all depends upon the area from where the tumor is being arised. Like if it is arising from the brain, then the symptoms will be the headache, early morning vomiting, seizures, like that. But if it is arising from the stomach, then the symptoms can be vomiting, epigastric pain. So, or if it is arising from the liver, then the symptoms can be the pain in the right hypochondrium, and there can be jaundice also. So, all depends upon the site from where the tumor is arising.
Okay. So, moving on, what are the risk factors?
So, the risk factor can be the modifiable risk factor and non-modifiable risk factor. So, if we talk about the non-modifiable risk factor like hypertension, like genetic, so we can't help it. But at least we can get the help by the modifiable risk factor like obesity, like exercising regularly, and cessation of smoking or avoiding the smoking, consumption of tobacco, and just leave the sedentary lifestyle of anybody. So these are certain risk factors which we should take care of, and we should be aware properly about that.
So sir, can you emphasize upon the role of genetics in causing cancer?
So as I told you that risk factor are some are the modifiable and some are the non-modifiable. So genetics comes under the non-modifiable risk factor. So now what happens, there are few types of genes in our body. Like one is a tumor suppressor gene, one is an oncogene, and third is a DNA, like DNA correction genes. So if there's a mutation in a tumor suppressor gene, these are the genes which suppresses the normal cells to become the tumor cells. So if there's a defect in that gene, then cancer can become rampant. And if there's a activation of the oncogene, so usually oncogenes are in a proto-oncogenes status, but when there's a mutation, it turns into the oncogene, and it promotes the cancerization of the normal cells. So these are the genes, and once the patient is having these type of genes because of any genetic mutations or because of any inherent mutation, then these type of cancer happens. So the examples of these type of genetic cancers like breast cancer, like prostate cancer, few cancers of the GI tract, gastrointestinal tract cancer, like colon cancer. So these are the cancers. So in order to prevent the genetic cancer, we should get nowadays we are having certain tests, genetic tests, so we should get ourselves checked, but it is not routinely done, and it is done only in a high risk patient in which the doctor feels that there's a genetic component also involved. Because these tests are costly, we cannot use them as a screening modality.
Exactly. Sir, are there any lifestyle changes that people can adopt in order to reduce the risk of cancer?
Yes, as I told you that there are modifiable risk factors which is in our hand, and we can always modify them. Like weight gain, we can stop weight gain by proper selection of the food, and there's a exposure to sunlight. We should avoid excessive exposure to sunlight, although we know that sunlight exposure is good for your health because of the formation of vitamin D inside our body, but it should be in the early morning sunlight, not in the middle of the day or excessive. Along with that, as I told you, like selection of the food, we should avoid food which is rich in fatty diet, and it should be in, more of roughage. So it decreases the risk of breast cancers, colorectal cancers, and the important thing, tobacco. So we should avoid tobacco in any form, be it a chewing, be it a cigarette or whatever. Some people also clean their teeth with some paste which contains tobacco. So we should avoid all these things. Along with that, alcohol, again, everybody knows that it causes a cancer of the rectum and hepatocellular carcinoma, that is cancer of liver. So we should totally avoid all these risk factors, and 50% of the time we can decrease the risk of the cancer by avoiding these risk factors.
Can cancer be cured?
Yes, again, this is a myth among general public, like cancer cannot be cured. And I have been treating the patient since 30 years. So I tell you, if we catch the cancer in an early stage, more than 60% to 70% cancer can be cured. Even the cancer, if it is in a locally advanced stage, few are the examples which have been cured. And because of nowadays we are having so good modality in a form of new surgical techniques, new medical oncology techniques, and of course new radiation oncology techniques, we are targeting the tumor cells. We are having a lot of things which target the tumor cells and they kill. So by doing this, all the tumor cells goes away and normal cells are least affected by that treatment. So we are having a lot of treatment. So whoever is diagnosed with a cancer, don't lose hope. As I told you, let's catch it in a very early stage, and more than 70 to 80% cancer will be cured, even if it is an advanced stage. So we can cure 20 to 30% of the cancer.
So sir, what are the treatments of cancer and what are their possible side effects?
Yeah. So if we talk about the treatment, it can widely be divided into three parts. One is a radiation part, that is radiation oncology. Other is a medical part called as a medical oncology, and third is a surgical part known as a surgical oncology. So if we talk about the because if suppose patient comes to us, if it is a localized disease, then we usually do the surgery followed by radiation. But if it is a systemic disease, like it has spread, then the role of surgery goes down, and the role of radiation and medical oncology like chemotherapies comes into the picture. So chemotherapies, earlier we used to treat our patient with only chemotherapies, which was a bit toxic. It was in a crude form. But nowadays we had made our treatment more targeted. Like chemotherapy, if we are using, it will only affect tumor and will not affect the normal organs like liver, like kidney. Earlier when we were using chemotherapy, we used to get more side effects of kidney, renal failure was there, and hepatic failure was there. But now we are using the targeted form of chemotherapeutic drugs, and along with that there are a lot more treatments also which are there available in the market.
So sir, what would be your message on this World Cancer Day?
So, as we all know that 4th February is a World Cancer Day, and we celebrate it every year. And it was basically, effort was by UICC, Union of International Cancer Control. So, the theme of 23-24 is Close the Care Gap. So, my message will be to increase the cancer awareness, emphasize the importance of cancer prevention, and let's celebrate the survivorship of the cancer on this day.
Thank you, sir, for coming on IndiaTV. So this was all about cancer, its symptoms and how it can be treated. If you have any questions, you can comment and let us know. Till then, keep watching IndiaTV.
Thank you.